Hi everyone, we're going to be talking about the evolution of the Greek drug law and how the current law works in their society today.
The Greek drug law of 1987 was first implemented in 1987 and has evolved ever since. The original law was made to differentiate sentences for personal use and commercial use of drugs. However, its main purpose was to help adopt the idea of seeing drug addicts as patients rather than criminals. Differentiating between drug addicts and non addicts created a basis for separation in how the individual was prosecuted. Drug addicts typically were sent to therapy or a program for addicts, whereas, depending on the severity of the offense, non addicts would be sent to prison for a length of time. The original law addressed all aspects of the problem, including repression, therapy, rehabilitation, research, and prevention. Over the years, there have been many modifications to this law. The first modification was in 1993. The 1993 modifications included more severe penalties for trafficking for doctors and pharmacists. The next modification was in 1995. These modifications focused on therapy and including the possible postponement of prosecution if the individual participated in a therapeutic program. The prosecution may be permanently suspended if the individual successfully completed the treatment. In 1996, lawmakers introduced a more lenient prosecution for drug users caught with possession. This included shorter sentences for minor offenses, which are still in place today.
The next modification was only 1 year later, in 1997. Lawmakers reintroduced a class of drug dealers as especially dangerous, and they can face lifetime imprisonment for repeat drug traffickers or for dealing using minors to minors. The 1999 modification made the law more lenient for drug trafficking of small amounts as a reason for their personal use. Finally, the last provision was made in 2013, and that is the version that they currently use in Greece. This modification included more lenient sentences with an emphasis on rehabilitation for drug addicts.
Like Carly just mentioned, the current version of the Greek drug law includes more lenient consequences for drug offenses. People using, possessing, or obtaining drugs for personal use can be sentenced to no more than 5 months in prison. If the individual does not commit another relevant offense within a 5 year period, the offense will not go on a criminal record. However, it is up to the judge's discretion to send that individual to a treatment center. This can take place in the community or in a prison setting. In 2013, all of the definitions of quantities of substances for personal use had been removed from the law. This means that the judge can make a decision on the severity of the sentence based on the substance, its quantity and purity, and the needs of the offender. Also, individuals that are convicted of drug supply may be sentenced up to 3 years if they are deemed a drug addict or sharing in a group. If not, they can be sentenced up to 8 years. In special cases like doctors, teachers, or drug therapists participating in drug trafficking, a life sentence can be obtained. Finally, if the judge finds the individual dealing dependent on drugs, they can be considered for a conditional release if they have served a minimum of 1/5 of their sentence and if they have successfully completed a drug treatment program. That individual would then be referred to a reintegration program outside of the prison.
We found this picture on the European Monitoring Center for Drugs and Drug Addiction. This shows the possibility of imprisonment for minor offenses for possession of drugs for personal use. Greece is outlined in black towards the bottom of the map. You can see that in Greece, there are a possibility of incarceration for any minor drug possession. The majority of countries in Europe can send individuals to prison for minor drug offenses. There are only 2 countries in Europe that don't sentence individuals to prison for minor cannabis possession: Ireland and Belgium. These countries are highlighted in yellow. Countries such as Spain, Portugal, Italy, Croatia, and Bulgaria do not sentence individuals to prison for minor drug offenses. These are the countries highlighted in red.
DLO stands for drug law offenses. In Greece, the monitoring of DOL data measures law enforcement activity and drug market dynamics. This data is used to help improve strategies and modify drug laws. According to the European Monitoring Center for Drugs and Drug Addiction, the Hellenic police have reported a steady increase in the number of drug law offenses since 2012. In 2016, the majority of drug law offenses were linked to the use or possession of illicit substances. About 2/3 of these offenses were related to cannabis, followed by opioid-related offenses. This is a picture that the European Monitoring Center for Drugs and Drug Addiction posted about 2016 drug offenses in Greece. There were a total of 17,741 drug offenses in 2016. The top 5 drugs seized were herbal cannabis, heroin, cocaine, cannabis resin, and MDMA. The majority of people who went to treatment were there for offenses with cannabis.
As you have just heard, the Greek drug law has many elements that promote rehabilitation. In the United States, our laws are based more on punishment rather than rehabilitation. Also, the Greek drug law focuses on differentiating sentences based on whether the offender is an addict or not. This is really interesting that it's not solely up to the judge's discretion and that the law recognizes drug addicts as patients. In both countries, however, the judge does have a say in the severity of sentencing. Thank you.